Okay. Good morning, everyone. I think we can get started. We have a fantastic panel presentation in standardized patients today. We are very excited to host another virtual session to wrap up the 2023 year. We have a few slides about Simulation Professionals of Texas. But before that, if this is your first time joining, awesome and welcome. If you already a member of the SPOT community, thank you for being here again. Before we go into the slides, there's gonna be a chat available for any questions. And also let us know where you're connecting and what's your institution so we can start. So let's go ahead start about what is SPOT. So what SPOT means Simulation Professionals of Texas. Our main goal is to provide education, collaboration, and networking opportunities for anyone involved in simulation field, whether you're an educator, specialist, administrator, or standardized patient. Today, the structure of SPOT, we have an advisory board. I hope anyone, Jeremiah or Laura is here, and our planning oversight committee. It's Erica. I don't think she's here today, but we welcome her to Crystal and myself, Ruben Torres. So we have some advisory board updates.
I think Jeremiah is just joining. So our advisory group has been working really hard to put together our bylaws. That's been the next really big focus to getting us set up as a 503c and finalizing our bank account. So we're making good progress. We're aiming to have those bylaws completed by January 2024. We're happy to share those with anybody who's interested, a part of our community. But definitely, if Jeremiah, you can jump in with any other updates if you'd like.
Hey, Crystal. No other updates at the time being, but yeah, I think you covered them for now. Thank you.
Thank you, Jeremiah. All right, so let's keep moving. We have some social media information. You can see the email that you can write us, Facebook and LinkedIn as well. Erica is the one that manage those social media, but we can all see what you are interested in. This is gonna be our agenda. So right now we're gonna start with the panel introduction. So we have four people that are very knowledgeable about standardized patients. So let's get started. So we're gonna break this into three sections and topics. But first, let's do the introduction. Each member will introduce themselves, their program, and their background in SIM. And we can go ahead and start with Carla.
Hi, my name is Carla Mosley, and I'm the program manager at UT Southwestern Medical Center. Our program started in 1990, and we moved to our new center in 2018. My background is I started out as an temporary admin, and I was at Extra SP when no one showed up, and I'm sure everybody on this panel has experienced that. And then I moved to SP trainer, and then to SP coordinator, and now the SP manager. So I've seen this program from start to finish. And we have on our team 6 full-time employees and 1 part-time employees. And we have a SP pool of 140 and hoping to grow that to 200. Thank you very much.
Thank you. How about Courtney?
Hi, everyone. Probably should start with howdy. I am from Texas A&M Clinical Learning Resource Center. I'm the Standardized Patient Program Manager there. I started with the CLRC in 2002 just as a standardized patient educator and eventually became the manager. Before that, I started out with the School of Medicine with TAMU in 2019 and began my journey through simulation at that time. The CLRC began operations in 2005. Our vision is to enhance the use of simulation to support safe, quality, and innovative learning experiences for individuals, teams, and organizations. We seek to bridge the gaps between theory and practice and build relationships with academic institutions, professional organizations, and industry leaders. We aspire to change the future of healthcare practice. We serve the School of Medicine, nursing, public health, pharmacy, as well as some external partners. We also have sites in Bryan College Station, which is where I'm physically located, as well as Round Rock, Houston, Dallas, and Fort Worth. The SP program is on all sites, but we also have a PETA, or Physical Exam Teaching Associate, a MUTA and GTA, and a telesim program. The SP program is the largest, and we are committed to providing high quality learning experiences through SP methodology as an integral part of our simulations.
Thank you. Diane?
I knew when I muted myself that was going to happen. Good morning, I'm Diane Ferguson. I'm at the University of Texas Health Science Center in San Antonio, otherwise is known as UT Health San Antonio. I've been in SP education since 1994, which is, if you don't realize, and Carla can relate, before the World Wide Web was really attached to a whole lot of things and had no information about SPs. I spent a lot of time in the library and on the phone. Our SP program here at UT at San Antonio was started in 1995. Now, I started it and created this whole new job for myself, it feels like. I also started the SP program at USF School of Medicine in Tampa, and I then came back to San Antonio in 2004 to open our current Clinical Skills Center in 2005. We are still part of the School of Medicine, and UME is our, the UME students are our main constituents. But obviously we also have GME, the School of Nursing, the School of Health Professions, the School of Dentistry, a couple of pharmacy schools, and the military medical program who all utilize our services. Our center was built for SP simulation. We have 20 exam rooms. But we do have 2 mannequin sim rooms, and we also do a lot of procedure training here. So, but mostly SPs. If you want to know anything about mannequin simulation, I don't know if anybody's in the group from our nursing school. They've got an amazing mannequin-based simulation center. Yeah, I think that's all I wanted to say.
Well, thank you. Thank you. Welcome. And thank you for accepting our invitation. Now, let's delight the community with your information and knowledge about standardized patient by moving to the topic number 1.
Oh, Monty.
Yeah, me.
Oh, sorry. Yes, I'm sorry.
Okay.
I apologize for that. Yes, Monty.
You're good.
Sorry.
No problem. You're fine. I'm Monty Gardner, and I am the Standardized Patient Director for the Texas Tech Health Sciences Center Simulation Program. I am located in Lubbock, Texas. That's kind of where our home base is at for simulation. We have other sites in Odessa, Midland, Amarillo, Abilene, Dallas, Mansfield, and then at each of those sites we have School of Nursing is pretty much at all the sites. School of Medicine we have here in Lubbock, and in Odessa and Amarillo. And then in Midland, we have the PA program. We also have space and hospital at San Antonio and Austin, which our ABSN students are at. We provide support for those two sites. Part of that is sending standardized patients. We do support that. So we have a lot of SPs that get on the road and travel quite a bit to go help out at different sites wherever we may be short. But we are pretty much, I think, kind of unique in that sense because we're spread out pretty much all over West Texas. We cover a lot of territory with our program. But that's pretty much, pretty much it.
Awesome. Thank you so much. And sorry that I
No,
forgot.
that's okay.
So, all right, now let's move on to topic one. I don't forget anyone, right?
You're good.
So the first question is, why standardized patients versus untrained volunteers? And we're gonna start with Courtney.
I actually think Diane was going to start with this question, but Diane, I can start if you would rather.
I'm ready. I was just going to
Go
pass
for
it off to you. So first of all, just to explain, a standardized patient is a layperson trained to portray a patient in realistic and repeatable ways for the education and assessment of learners. So the name standardized patient is what we usually think of when we say SP here in North America. But these people can perform many other functions in simulations and teaching sessions. So you may hear the term simulated patients, simulated participants. They're all SPs. We call our SP, our SPs are our SPs. They do a million different jobs for us, and it's fantastic. In fact, the Association of Standardized Patient Educators has changed its name to the Association of SP Educators in order to embrace all aspects of human simulation globally. When we want standardized patients, then we as simulationists must standardize them so that their portrayals are repeatable. And every learner then sees the same patient. That's the idea behind a standardized patient. So that standardization, is important, and especially for assessments. So we do a lot of training with our SPs, and they are trained specifically to portray a case the same as the SP next door who may be portraying the same case, or as the same patient, as the same family member for every student or student group that comes in. So that's the idea behind the training. And that's one of the reasons that volunteers who are wonderful, but a lot of times it's hard to bring volunteers in for training. And in the healthcare setting, they may not be that familiar with it. They may be somebody who works somewhere else. And so the degree of standardization and portrayal accuracy may falter a little in that situation, and you may not meet the objectives of the simulation or have a poor outcome. Courtney's going to talk a little more about why SPs.
Yes. So when we look at the using SPs versus the untrained volunteers or even trained volunteers, level of professionalism that we get with standardized patients opposed to using volunteers. When we use our standardized patients, there are certain expectations and standards we have for them, and it allows us to also do professional development with them. I'm sure anyone who works with standardized patients here would agree they take their role very seriously, and at least in our center, and I'm sure everyone else's as well, they're wanting to improve in that role and they're wanting to be developed in that role as well. So when we use our standardized patients, we can offer those professional development opportunities opportunities, which enhance them, but also improve our own programs and our own standardization that Diane talked about. We also have a level of commitment when we use the standardized patients opposed to volunteers. That is definitely something that's needed within the program, not just for making sure people arrive on time and those logistical pieces, but also it allows us to provide performance improvement for those standardized patients to continue with quality assurance as well as quality improvement.
Got it. So for the second question is, what type of simulations lend themselves to best to SPs? That'll be Monty.
Yeah. So I know for our program, RSPs, we use them a lot for basically playing the role of a patient, for the most part, putting them, we use them for formative learning, formative testing, summative testing, but it really is a very structured case format. I think SPs, they perform better in those types of situations whenever they understand what they need to say, how they need to act, what they need to do whenever it comes to a physical exam, how they need to, if there's any type of pain that's involved, that type of thing. So SPs really, in my opinion, they just need a lot of structure on their cases, but they do predominantly play the role of being the patient in the room. They also can play family members. So we do simulations where the mannequin will be the patient, and the student will need to basically interact with the family member. So they'll have a set amount of questions that they ask the student while they're going through their, while the student's going through their assessment. And that way the student gets that practice of communicating to the family member as well. And of course, standardized patients, they can, do the assessment on the students. They're trained in the assessment part, the checklist that they fill out on the students, giving verbal feedback to the students whenever it's just like formative learning, those types of things, very valuable feedback to the students so they can improve each time. But that's pretty much the role that RSPs, a lot of them play in for ours. So
thank you.
I think Carl
and
is going to add to it.
Yes.
They can also play role. They can also be warm bodies or physical exam models in helping faculty to teach physical exams, and then also for the learners to be tested on their physical exam skills. And we also use them also as ultrasound models during the ultrasound workshops. And any invasive, there are some invasive exams we use specialized SPs, like GTAs. But that's all I can think of we use at our center.
All right. So a third question is, how do you define a SP in your program? I don't know if we cover on the introduction, but if you have some input, you're more than welcome to jump in.
I think I was supposed to start, so.
Yeah.
So briefly, I mean, I kind of went over what an SP is, but our SPs are, I'd say 99% laypersons. We have lots of teachers, and we have lots of retirees who've done lots of amazing things, but we don't have too many healthcare providers who become SPs. They portray patients, family members, and occasionally healthcare providers. So we have a couple of OSCEs where they portray physicians. Mostly they're just listening to what the student says. So they don't have to be trained to be a physician. They just need to be able to intake the information. And then they respond to learners in real time and with a patient or family member perspective. And that's what's so special, right, about SPs. They have to have an appropriate demeanor that creates the clinical, that recreates the clinical environment. And they also provide immediate verbal feedback to learners, which is part of the SP training, but is a very special part of the student experience. So they get patient feedback immediately after they do a clinical encounter.
Yeah, our center is very similar in how we define standardized patients, as Diane mentioned. We also very much value that immediate feedback that we're able to give to learners, because a mannequin can't tell a student how they made them feel as a patient, but a person can. And so that's why they're so valuable within our program. Is the student might be doing the mechanics correctly, but they can say, I really loved the way you showed empathy in this moment, to help the students improve that skill as well. Diane talked a little bit earlier about the difference between a standardized patient and a simulated participant. Within our program, we're exploring moving out away from just healthcare professions when we use our SPs into other industries as well. And so that is something that we are still exploring, but looking to define further within our program.
Yeah, I'll kind of add to that, because we kind of do that with we're connected to our medical center hospital, and they actually use our SPs to help train their employees, from their staff who cleans the rooms, to their charge nurses, to the nurses who draw blood, those types of people. So they bring them in, run them through, they've taken feedback from customers on what they need to improve on. So they've created these scenarios based on that. And so they bring all their employees over at various times, and they'll run them through those scenarios where they've I just gotten negative feedback. That way their employees can better understand how to interact with the patients when they're asked questions, where they don't just like, oh, I don't know, I'll try to find somebody for you, but so they can be more helpful to their patients and customers. So yeah, we do that currently.
Good point, Monty. Thank you.
Anyone else? So we can move to topic number 2. All right. All right, so the topic number 2 will be the program management. So the question number 1 will be, how do you recruit SPs in your program?
For our program, I'm sorry. For our program, we usually referrals are majority use. We ask our SPs to give us referrals, and we do that because they are instrumental in telling the future SP all about the program, what's required, and they will not refer anybody that they feel is not ready for the program. We also found that they stay longer because we have SPs who have been with us over the 30 years we've been in business. And on occasion, we do go to our human resources applicants. We get a few people hired, but they don't last very long. So referrals, we always ask our SPs, new hires, their staff members for referrals.
Yeah, at the Texas A&M CLRC, we have done a various number of recruitment.
Uh-oh.
Oh, I think she dropped up.
Very
Can you guys hear me?
Yeah.
Yes.
Sorry about that. My Zoom quit on me. So yeah, we use various different recruiting techniques. We've tried social media posts, reaching out to theater groups, doing interest meetings. We're lucky at our center as well that, at least in the Bryan College Station campus, we're very close to the Texas A&M main campus, which means that we can recruit students for our younger SP population. But just like Carla said, the most effective thing has really been that word of mouth and the referrals from other standardized patients. They're the ones who get really excited about the program and share it with others that they know would be good use within the program.
I completely agree. Word of mouth is one of the best ways to do it. And for all the reasons Carla said, I would say at USF, I was attached, as Courtney mentioned, to a university where we did have more recruitment ability of younger SPs, which are very hard to find and to keep because they have other things to do besides BSPs, whereas retirees, this is just fun for them. And the theater department was a good place for me to get some of the SPs that I needed for specific roles that were kind of high acting type of roles. I don't have that here as much. So
yeah, and I'll say, yeah, definitely word of mouth is really, really top on the list. SPs, they love doing this and they love to tell people what they do. And I agree, they try to only tell people that they would feel comfortable working with, that they would trust. But some of our faculty, they've been really good at, telling people, recruiting. When we open our hiring rec, so whenever we open up an application, it will go straight to Indeed. We'll pull it off of our hiring site, and then it goes out to Indeed. And then we get, I get like a lot of people who apply that saw it on Indeed. Now, a lot of them don't work out because they're not familiar with what they do, but we have gotten quite a few that, they know what it is. They've heard about it and they're very interested in doing it. We actually have an SP brochure that we pass out that we can put in high traffic areas. Sometimes when our university, they do job fairs, they'll take those brochures and pass them out. And we have a little QR code on the brochure that allows people to fill out what's called it's just like an inquiry form, and it comes straight to us. And basically they let us know what their availability is. Can they work the hours that we're open, and then allows us to contact them and do a little vetting before they actually apply. And then on our website, if anybody goes to our website, they can click on like the SP portal part and they can fill out an inquiry form. But that's kind of how we recruit. So
that's a really good point, Monty, because if we have a form online. So most people know to send, from word of mouth, send people to the online form, and we do look over it before we go any further with that HR type process, because if they're all immediately not going to be a fit, then we have to contact them and just, say, well, we kind of need somebody who can work more than, 1/2 day a week.
Yeah.
So yeah, that's a really good point.
Awesome. And that's a way you recruit for overall, but how about when you have to recruit for a specific activity?
Yeah, so with the CLRC, we try to book our SPs for events 6 weeks out. Of course, there's always the odd event that will pop up less than 6 weeks out that we recruit for, but in general, we try to have everyone booked 6 weeks out. And so we send availability to our SP pool to see who's available for the needed events. And then we prioritize hiring for that event based on the case demographics, gender, age, that kind of thing. But as we've kind of mentioned, there are certain cases that are harder to recruit for, such as the younger population. And so there are times we have to really rely on that fiction contract and tell the students go by the age on the door sign and not by appearance, because we might have an older SP playing a teenager if we really don't have any young one available. We do have certain events that require a little additional training and competency to be able to do. So the ones that have that verbal feedback component, or our high stakes summative events, or even our really high emotion cases, in those instances, we have a part of our SP pool that have been trained for those or have showed proficiency in those competencies. And so we will target recruit to that pool specifically when we're booking for those events. With our new or novice SPs, we really try to start them on easier events. Since we have both nursing and medicine events, our nursing events tend to be easier for novice SPs than our medicine events, which have a lot of feedback and evaluation. And so we'll start them on those events, as well as use them to, they observe some of our veteran SPs as they're progressing through their training.
I concur. I mean, I think we pretty much do the same thing as Courtney. I don't know that I have anything to add.
I have nothing to add.
Yeah,
think it's been covered.
yeah, that's kind of how I think everybody kind of does it the same way. We actually do have I have a relationship with the local high school. They have like a health sciences class. And so we do have a program with the nurse practitioners. Their students are geared towards, the adolescents type of thing, including teenagers up to, 18, 19 years old. And we actually get some local high school kids to volunteer to play the role of the teenager. But then we have SPs that are actual SPs are in the room with them playing the role of the guardian. And so then they can help evaluate at the end. The SPs will evaluate the students, and they can kind of fill in some information. If the kids kind of forget something, they can fill in that information. But it's a good experience for the students, because they actually get to actually work with a high school student who, acts like a high school student. So it's a great experience for them. But
That's great.
Good. Any other input, Ms. Carla?
No, I think they've covered it all. Thank you.
Awesome. So now you have all these recruitment, you have all these participants, and let's talk about the training, about the overall training for SPs in your program.
So probably like most SP programs, we have general training that all SPs need to participate in. And we have a 2-part physical exam training. It's over 2-part. It's over a couple of days, because the physical exam is long and hard. And we also have a overall training for verbal feedback. We have an overall training for using our interpersonal skills and communication tool. And then in addition to that, because our SPs are employees, they also have all of the compliance trainings that the state of Texas tells us they have to have. So there's really 3 main general overall trainings that we specifically do for our SPs. Most of these occur in the 6 weeks-ish of summer that we get between groups of students, and so that they're prepared for the next year. And that's when we put new people into the group and that sort of thing. Until then, most of our SPs are trained on an as-needed basis if they join in the middle of the year.
yeah, for ours, we have an orientation, kind of an orientation to the program. We go over policies, procedures, just all the little things that you need to know, before you walk in the door, things like dress code, how you dress during encounters, things like that. And they'll go through that. And then with ours, we're pretty much busy almost the whole year round. We always have something going on with different programs. So it kind of depends on when they start, where we're at in the semester. We never start them off on testing or anything like that. It's usually just really simple simulations. So we'll bring them in, kind of orient them to the surroundings, equipment, that type of thing. And then they can, maybe they're going to just observe, or maybe they can work if it's something that's not too complicated. But we do try to bring them in for observation so they can kind of see the flow of how everything works. And of course, it depends if it's formative learning or formative testing or that type of thing, as to how we kind of approach that type of training. And then we always try to have veteran SPs. We have lead SPs that help us with kind of mentoring the new SPs. But we also have veteran SPs that then want the responsibility of being a lead SP. They just like being an SP, but they're very good at mentoring new SPs and kind of showing them the ropes and how that type of thing goes. But when you have so many different programs do things differently. So it just kind of depends on when you get them started, what you have available, what you're bringing them in for, that type of thing. So, but that's how we do it on ours. So.
All right. How about you, Miss Carla?
I think they've covered everything that we do too. So we're all pretty much on the same page on the overall orientation, compliance training, and the verbal feedback component is always on the initial part of the training.
Good. Any other input, Miss Courtney? Something that you can let us know that is not being covered yet?
Sure. So like everyone said, we do all the same things when they initially are hired. We also do offer biannual SP professional development sessions for our SPs that are not novice, but that way they can continue to improve their skills and keep up the proficiency of the program. And so there are some great resources. I'm going to go ahead and plug ASPE here, but there's some great resources on ASPE for that if anyone is interested in doing something similar.
Good. So here within our own college, we don't have SPs right now. We're working towards that. But I always wondering on the training for a specific event, like for example, scripts or rehearsal within the SP workers. Like how do you do that?
Yeah. So for our program, whenever it comes, testing time, we typically will train the SPs. Whenever it comes to some of the formative testing, all summative testing, we will, and since we're typically testing on, we may be testing at 5-6 different sites. So we'll have 30-40 SPs playing the same, patient across, all of West Texas. And so we've incorporated Zoom into our training process. That way we can get everybody together, and we have one person, that trains the case. That way everybody gets that training, even training. You don't have 4 different people training an SP here and there and it becomes uneven, that type of thing. So we have one person that does the training. And they just basically go over the script, from the beginning, from the introduction of the student till the time the student leaves. They go over all of the questions that students should ask to get the correct diagnosis, make sure the SPs are on point with all that, how they're supposed to be dressed. If there's any physical exam findings, we cover all that. when do you give the physical exam finding, you know, when to give the information, when to withhold. The students don't, if the students don't ask, you don't tell, you know, that type of training. And then we'll even do, we will do like a, we'll have an SP, a couple SP, one will play the role of the student, one will play the role of the SP, and they go through the actual encounter, how it might flow, you know, where one SP is asking questions that the students will probably ask, and then the other SP is portraying the role like they would in the room. And so that helps the SP kind of get a grasp of what to expect, you know, on testing day. But that's pretty much how we do pretty much all of our testing for, you know, for all the programs. So Zoom's become really a great resource to help standardize the testing across multiple campuses. So
for our program, we usually do our training 5 weeks prior to the activity on all activities, whether it's formative or summative. And in those 5 weeks, once a week for about an hour, there's different trainings that occur. We start off first with what we call a patient quiz session. And we created a quiz to kind of give the SPs an idea of what may be asked of them. And we put all those patients with that same script in that session. And we go over those details so that everybody has the same response and the same answer based on what the student learner asks. The second session is broken out into pairs, and we try to pair up a seasoned SP with a new SP. And it's called a script rehearsal. And the script rehearsal, it's the second training. They go over the script, they perform the script. We're looking at the accuracy of data, of the information, the demeanor, making sure they have answers to those questions that are not in that patient quiz. And then we go over the SP evaluation, the learning evaluation training. So we go over all details of that. And then the third training is called final rehearsal. And on the final rehearsal, we do it from start to finish. And in between final and script and final, we do have them do a refresher for the feedback. So at the final rehearsal, we also require them to write written feedback. And then we have one last session, which is, we call it our check off or dry run with the faculty or whoever's over the program, so that they can go through that process with the SPs to make sure that SP meets their criteria. And that's our training process.
Good.
Yeah, the Texas A&M, we do very similar things to what Monty and Carla have already said. We also have the same challenge that Monty brought up of trying to standardize it across multiple sites, because just like Monty, we have a case that might be running on all sites at the same time, and we want to make sure that all students are seeing the same portrayal of that case. Zoom, I will also agree that that has been very helpful in terms of standardizing that. We also have a standardized training checklist that our SPEs follow in each site when they train to make sure they're covering all the aspects. And then me as manager, I review trainings with my SPEs on all sites to make sure we are meeting our program objectives and doing that standardized training. Our training includes all the same things that Monty and Carla have already mentioned, going over logistics of the event overview and introduction, looking at any questions that the SPs have, asking for comprehension of their case, role portrayal, physical exam findings, all of those components. We also, if the case is high emotion, we do emotional de-rolling and debriefing at that time as well as offering that after the event to provide that psychological safety for those events.
Sounds great. I don't have a whole lot to add. Sounds like we all kind of do the same thing.
Good. Well, let's move on now. So now you had your recruitment, the training. Now, how about the evaluation, the overall evaluation for your SP in your program? Can we start with you, Ms. Carla?
Sure. Well, the overall program, we do a yearly evaluation of our SPs based on their performances during the whole year. And we use for every specific event or training, we also evaluate them as well. So we're going over those things. So at the end that we know what we need to coach our SPs on, or, who to give the high five to for their performances.
At A&M, very similar. We do evaluate them that way as well. We also, because we have those biannual professional development sessions, if there is an overall theme we're seeing with our SPs across campuses of something they maybe need more training on or something like that, we'll incorporate that in those professional development sessions. For example, the one we did this past summer, we really focused on providing verbal and written feedback to make sure we were all providing feedback standardized across sites. We evaluate them based on the criteria of the cases as well as our program standards. We provide feedback to SPs real time, like when the events are occurring between sessions, as well as bringing them in for remediation as needed.
Sorry. Our evaluation overall is generally the same. It's essentially a performance review. That doesn't occur necessarily at one time. That mostly occurs within certain time frames after the SP starts. Some of our SPs don't last very long, so we don't want to have too much evaluative time devoted to somebody who's only been there for 6 months. So generally we try to give them just in time evaluations.
Our kind of the overall evaluation, it's kind of the same thing. It's usually maybe yearly type of thing, where it's just kind of, are you there on time? Are you dependable? Those types of things, just kind of as an overall evaluation. But then we'll get to this here in a minute, but we do more on the specific events evaluations, but I think we're going to talk about that here in a minute. So
yeah, and that leads to the the next question, like you evaluating a specific events on those ISPs.
Yeah, so like Monty mentioned, we do a lot of evaluation per the event. So at our sites, our SPEs during our events are observing the SP performance. Live time, we are able to see all the rooms, listen in and see how the performance is going. When we have faculty reviewers for those events as well, we're also in touch with our faculty on the SP performance. And if there's anything that needs to be corrected, changed, or commended, if it's something that we see that needs to be corrected real time, we do go in between students to talk with the SPs about that. But overall, we are making sure that they're meeting those case objectives and standards. We book backup SPs for our events for the event that someone gets sick and can't show up. And if everyone shows up and that backup is not needed in the room, we also use them for our quality assurance. We'll have them watch encounters. We have a checklist or a guide for them to review as they're watching to kind of help us evaluate the performance of that particular SP. It's a good refresher for the backups as well as helps us with manpower in watching those encounters. And then for our high stakes testing events, anything that is really summative or high stakes, our staff will review any failures that happen with those events. So we'll actually watch the encounters, grade the checklists, compare it to how the SPs grade the checklists. And then if we see any issues there in terms of how they're filling out those evaluations, we'll correct the SP on that as well as review any comments that they provided on those checklists.
Okay, thank you, Courtney. That's pretty much exactly what we do.
We do very similar. So we've kind of created a little a forum and we have it on a QR code actually. So if we have an SP, we try to have a lead SP, like when we do summative, to be there and watch. But we can have any SP that's a veteran SP. They can just scan that QR code and they can fill it out on their phone. It's just basically, portrayal performance. Did they give appropriate information? Were their mannerisms correct? Were they dressed properly? Just those types of information. But they can fill it out on their phone just real quick. It only takes like 5 minutes to do it. And we get a lot of valuable information from that. We can have faculty do the same thing. Some faculty will be watching live and they can give us real-time feedback on that evaluation form. And then we can collect all those forms and we can keep them digitally rather than having a whole bunch of paper files. But we can keep all their evaluations, and we like to use Box here at Texas Tech. And so we have all these Box files for all of our SPs, and we can drop all those evaluations in and kind of review them. And that's kind of how we try to, who's the best SPs for summative. So, it helps us to review all that and make sure that if there's SPs that need a little more training here and there on different things, we can provide that, and just try to have the best people best SPs that we can, for summative. But those help out quite a bit on those forms. So
good. Any other input, Ms. Carla?
No, I think it's been covered. Yeah, we do the
Awesome.
same. We all pretty much do the same things.
Good.
I will.
So yes,
I'm sorry.
go ahead.
I was just
No,
going to
go
say,
ahead.
Monty brought up something that I just, to clarify for, those of you who are maybe new to this, there are two ways to sort of evaluate our SPs, one, especially for a specific event. And one of them is performance. Are they doing within the role? Are they doing what we want them to do? Are they giving the information appropriately and things like that? And then there is often a checklist that in a summative situation that the SP has to fill out. And so there's also sort of some QA about the accuracy of the checklist. And that's what Courtney was referring to when she talked about reviewing the questions and things like that, and how the students are doing during an event. Most of our events, I don't know about, I'm sure at Southwestern, I don't know how many students are at other schools, but most of our events occur over a minimum of 6 afternoons. So we have time to tweak things.
Yeah. So that leads us to the last question. I know we're almost reaching out to the end, and we want to give some opportunity for the attendees to ask questions, but I would like just to cover this last question real quick. When you get all your SPs, are they employees of the institution? Are they contract, PRN? Can you just tell us briefly on that?
So,
Okay, go ahead.
oh, sorry. Ours are hourly.
We can start with Diane.
Okay.
Okay.
Ours are hourly employees. They are PRN employees though, and that comes with minimal benefits. But as such, they can be terminated if they're not fulfilling their commitments.
Yeah, our SPs are employees of the institution. They have to go through the HR process, background checks, all that type of thing. It's a little cumbersome. It takes a little bit of time to get them through, but yes, they are considered PRN employees, part-time as needed. If you don't need them, then you don't use them. So.
And ours are part-time, our PRN SPs as well, employees. No benefits though.
Yeah, no benefits. Yeah.
No benefits. Okay.
Ours are actually 1099 independent contractors.
Awesome. All right. Well, that concludes the questions. I think we can open the chat. Crystal, can
Yeah.
you see if there are some questions
There's
for our
actually
panelists?
quite a few, so I don't know if we're gonna
Oh,
get to them
Jesus.
all, but I'm gonna go ahead and start with the last question we received from Amelia Hutchinson. The question was, earlier in the presentation, someone had mentioned standards from the state of Texas that they require for SPs. They were hoping we could elaborate on what those requirements are.
Yeah, I'm sorry, that was me. I was actually referring to the University of Texas system that requires them. I'm still sure that many of them are state, but I don't actually know. But what I'm talking about are things like IT security, FERPA, HIPAA.
That makes sense.
I don't know. It goes on. It feels like forever.
Title IX, Title VII, all
Yeah,
Yes,
all the
yes.
animal requirements.
Yeah. A lot of things that in honest, if we're being honest, they never encounter because they're never really inside that part of the university. But certainly FERPA is a good thing for them to know about, and as is HIPAA. I think everybody should know about HIPAA. So
yeah, we're really big on the Title IX. Our IT department and HR department. The Title IX.
Yeah.
Those are important. Okay. Moving on to the next question. I think a lot of people have asked this question before. This is a little bit different of a spotlight. Do you know the average financial or resource cost of hiring a standardized patient? So things this individual, which is Stephanie Eder, asked were, what's the cost to do interviews, job advertising, or job postings?
Well, for us, it doesn't really cost anything for, job postings or anything like that, because we go through our HR department. When Indeed pulls it, they just pull it. We don't have to pay Indeed for anything. It's just like a bot that goes in and pulls that information and puts it out there. So we don't really have to pay for that. The only thing we'll pay them for, their orientation time and any, observation time, that type of thing. And I mean, you could wrap up, maybe 10 hours of just kind of getting them, in orientation training, that type of thing. So it just kind of depends on how much you pay an hour, but yeah, I mean, and it kind of depends on how fast the SP learns, how often they work. The more they work, the more they learn. Some people learn faster than others. So, but I would say you could easily have 10 hours minimum wrapped up into just kind of a basic training just to kind of get them going,
Absolutely. Any other panelists have something to add? No? Okay. The next question, I think, is a hot topic in the world of standardized patients. And Kim had to jump off from Children's, but her question was, what are your programmatic approaches for integrating equity, diversity, and inclusion in curricula for training health professionals when selecting standardized patients? And those who are state entities probably have a new spin on this now with the statewide mandates. So I'll leave it at that and let you answer.
I'll just be honest, at least in terms of our ability to do anything special. That has obviously been quite boxed, shall we say, and put away.
Good way
Yeah. But we do have some undergraduate, not undergraduate, what am I trying to say? Like junior college. What is it? 2-year college.
associate's degree.
Associate,
Yeah.
yes. Programs where we've gone specifically to recruit And we have, I'm, in San Antonio. So our SP population definitely represents at minimum our Hispanic population, just because they're the majority here. So otherwise, we just hope that somebody applies that falls into those categories we're looking for.
Yeah.
It's a terrible answer, but if you want to know how we would go about it, you're welcome to contact me.
Yes, and I just put the resource page there so you have all the contact information for our panelists. I think we're ready to wrap up. Thank you so much for being here. Thank you, panelists, to be able to help us. From the bottom of our heart, please contact them. They're the experts. I have tons of questions. It's being recorded, and I'm sure it's gonna be uploaded. So don't forget to follow us in the social media and wait for the video there. And they are more than open to answer any questions after we end the session. Thank you so much. We'll see you around.